Hey everybody, my name is Nick Denne. I'm one of the faculty at West Virginia University. I'm joined alongside Dr. Joe Minardi.
Hi folks.
We're going to talk about augmented reality and medical education. Thanks for joining us today. So just to introduce, we have no disclosures. None of the products that we will talk about, we are not paid spokespersons for either one of these, any of this content that we have here. How many of you have experienced this exact scenario whenever you're teaching, especially ultrasound, to medical students?
Hey, Dr. Denne, I'm having trouble getting good views on the echo. Can you give me any tips?
So whenever you're looking for a parasternal long, here, let me use my cell phone. So pretend the on-off switch is the indicator. So for parasternal long, you're going to be just to the left of the sternum with the indicator going toward the patient's right shoulder. Then you're going to rotate for a parasternal short. For apical 4, you're going to have your indicator up and in toward the axilla. And then down for the subxiphoid, I'm going to have you come down and have your indicator pointed to the patient's left. Does that make sense?
So we've all had that moment where we're using any object that we have around us, our hands, our cell phones, and we turn and look at our learners, and this is what we get.
So frequently when we teach ultrasound, a lot of us start out with kind of didactic presentations where we have different styles or methods of trying to impart this education and this multiplanar anatomy to some of our students. These are just a few samplings of things we've used in the past, where we have these static images and we have these cut planes that look like this. We'll take these different slices showing the image side by side. I've even used scenarios where I tried to take old pictures from other anatomical courses and tried to show them the correlations between that and what that looks like on the echo screen to varying success. Sometimes we'll take other things like this, where we take anatomical images and then we try to, again, show the projections of what the anatomy looks like. These are all pretty variable in how effective they are. Here it is for the apical 4. We've all seen this kind of stuff, right? Just another example of the subcostal, showing that anatomical orientation. And one of my favorites is flipping around in multiple orientations, images from cardiac MRI, and trying to show students and or residents how that correlates with what they're going to see on the echo screen. And then some of the most popular, I'm lying, these were the least effective, least popular ways I tried to demonstrate how some of these slices were, was showing what a slice would look like from a particular observer's perspective. And I actually had students come up to me and say, "Hey, Dr. Minardi, please don't use those anymore. They're terrible and they made me more confused." So struggle with things like this every year, all the time, teaching new learners, new residents, new students. And we were fortunate enough to incorporate some technology that would allow us to do things a little bit differently. And so we're going to talk a little bit through what we used with, this is the Vimedix product. Again, they're not endorsing us. We're not endorsing this product necessarily itself, but a platform. And there are others out there that offers an augmented reality solution to help new learners better grasp ultrasound anatomy, especially the multiplanar anatomy of echocardiography.
So if we all think back to whenever we were learning ultrasound, the biggest issue that most of us had was orienting the anatomy on the patient with the anatomy on the screen with the indicator on the transducer. So we basically looked at how augmented reality platforms, augmented reality and virtual reality platforms can help improve understanding the relation of the image that is projected onto the screen with the image that is that you are trying to teach to the student. So dating back to 1991 was the first mention of electric cadavers as the product that was portrayed in the FDA consumer article that is mentioned here. Advancing forward to 1994 in Lancet, virtual reality and medical education started to become populated in some of the literature, although no formal studies had been done. But this was kind of the introduction of when things started to happen. Advancing forward, and we won't belabor all of these studies, but this is just to illustrate some of the newer studies that are out there currently. Augmented reality ultrasound trainer apps for kidney ultrasound. One of the main areas of augmented and virtual reality is currently being studied is in health science education. Here in the medical anatomy department of Bond University. And then probably one of the most focal areas that we see a lot of the virtual reality simulators are in the surgical education portion. Virtual reality for laparoscopic surgeries. Some of these date back to the early 2010s. More recently, though, as I said, the ultrasound in medical education has become more populous in the literature, although not overwhelming. You can even see in some of the newer literature that it's expanding out among nurse practitioner students and other health professions, not just in medical education, medical training, but in nursing and nurse practitioner education as well. So one of the important things to address is augmented versus virtual reality and establishing the difference between these two features. So augmented reality is just that. It's your physical surroundings remain your physical surroundings, and there is a projected image onto your surroundings that you're able to interpret while still being cognizant of all of your surroundings. So I don't know if any of you remember the Pokemon Go app from several years ago.
I'm playing it right now.
And my family played it for years. But that's an example of augmented reality.
There's a Pikachu in the corner.
Virtual reality, however, is a little bit different. Virtual reality is entirely submersive. With the use of headsets and the various devices, you kind of lose track of all that is around you. You actually become part of this virtual world in which you lose your surroundings and you lose contact with those that are around you.
So just to jump in a little bit, understanding the difference between AR and VR, what we did incorporating augmented reality into different parts of our curriculum, most formally in our medical student curriculum, but this actually carries over to what we do with residents and even fellows at times. And as any of us in emergency medicine as the leaders in ultrasound education at many of our institutions and schools, hopefully this is a useful demonstration of what some of this technology can offer.
Here's some of our faculty at West Virginia University, and it's important to recognize that these are the goggles that you wear with this particular product, and the image that is portrayed in these slides here is the actual image that are seen through the goggles. So you can layer out different body structures, however, still recognizing that your surroundings are still your surroundings in this augmented reality. Here's some more images from some of the products that we use at West Virginia to educate our medical students and our nursing students. But here's a view of a parasternal long axis in the heart and the various views that you can achieve through the software, both ultrasound images and augmented reality of the actual patient. More images that you're seeing, just changes the angle, seeing parasternal short axis views, and what you're able to describe and what you're able to show your learner as the image is portrayed on the screen for you to teach.
And I think it's important to kind of point out, this is not a trick we played with Photoshop and these images. This is video. The top image you see there, this is video actually taken through the goggle headset showing you what the students or residents or fellows actually see through the headset. So just to illustrate the immersiveness and the kind of real-time orientation of the anatomy.
But you can see how much of a help this is to have all of these types of images at your fingertips to show your learner, this is the image of the heart, this is how you're looking up through the thoracic cavity, this is the image that's portrayed on the ultrasound, and it's all right there within the same software program. Some of the last images here, just subxiphoid. Again, you can just see the exact angle that your ultrasound transducer projects through the thoracic cavity, showing you the anatomic structures, showing you the ultrasound image of those same structures.
So just to go a little bit into the methods of the study we performed to help us evaluate the utility of the technology, our medical students, starting in first year, do ultrasound, starting in gross anatomy and kind of all through the medical school curriculum. And in the last couple of years, we introduced the augmented reality platform into that training. We gave them some brief introduction to the platform, showed them how to use it, gave them some experience looking at the different views during our other ultrasound hands-on sessions, and then we allowed them to practice and gave them access to the technology kind of outside of class on their own time. So the introduction and formal time was pretty brief, but the hope was to allow them and encourage them to practice with it and gain some more experience in their own time. And then afterwards, we surveyed the students to see mostly attitudinal things about how they felt the technology helped them understand multiplanar anatomy and things like that. We did not do a control group. We didn't want some students to feel like others had an advantage, so that'll be one of the limitations we talk about later. So over the couple years that we've done this so far, most of the students completed our survey. Pretty much all of them enjoyed using the platform. And this was not a requirement to do this, but almost half of them came outside of class to just practice on their own. And the people who did come averaged around 90 minutes of practice time. So that's pretty impressive to get stressed medical students to come and do extracurricular things that aren't required and aren't necessarily going to be assessed later on.
And it shows the value that they felt that this was important for them.
And so the students reported that the AR, even the ones who didn't come to class, so this includes them as well, they reported that this helped them better understand the images in relation to human anatomy, especially the cardiac views. They thought that it helped them acquire images and give them more confidence in acquiring those images. We also had them give comments, and the general themes in their comments were that it was fun, but they did find it a little bit intimidating. They loved being able to real-time 3D visualize the anatomy, and then there were multiple comments about the short battery life of the headsets. So we felt that based on our results that it's fair to say the students thought it was well perceived, and then we're looking at future ways to evaluate, are there improvements in test scores and psychomotor assessments? So when we do practical assessments of their skills, do they do better? Do they acquire images more quickly? We also felt, based on the comments and just based on our observations of how the sessions would go, that improving access and making things a little easier to use might improve their engagement with the technology. And we're going to kind of talk about that a little bit.
As always, there's drawbacks. There's drawbacks to everything, cost being one of the main ones. Dr. Minardi already pointed out battery life was one of the main topics that our students kept talking about. The glasses have a limited amount of time that you can learn with them, and let's face it, it's tough to convince people to plug things back in after they're done using them, and that always has problems.
And the other part is we're at a large medical school, a health sciences center, and with a large simulation center that's got the resources to kind of purchase this stuff. The Biomedics platform is not cheap. You're not probably going to buy this for a group of 10 residents. So being plugged in to a health sciences center or a bigger university, it definitely makes this accessible. But that's going to limit some of its utilization kind of more generally. The other thing I think that some of the students kind of mentioned and we saw is after you get one or two views, you kind of know where they are, right? So it's a little bit predictable. Now, as more software is introduced that allows different cases and more cases to be implemented using this AR technology, I think that will change and that will improve that a little bit. So some of the things that we've already incorporated, we've acquired more headsets so more students can look at once or can participate at once, or just so we have some always charging for the next round of students when they come around, because the battery life is pretty short on these things.
And then going back to what Dr. Minardi said, once you find the utility of orienting your personal space and the ultrasound images as they are acquired, you almost need a little bit more on top of that. So incorporating some medical decision making, some pathologic-based cases is always going to be the future, where you can have simulation models with students learning on their own, self-guided sessions. These students already displayed the interest in going in on some of their off times and going in and learning this on their own. So having medical decision making for residents and some of the advanced learners is always a bonus.
And we should probably mention one of the limitations of the self-guided sessions is the glasses themselves. They don't always work right when you first put them on. So a lot of times you need some other technical support to help you troubleshoot the glasses and why maybe you aren't seeing the 3D images that you should see. So as that technology advances and becomes a little more just put it on and it pretty much always works, I think that will increase the access and the use as well. So just to close out, just taking a look here again, this is augmented reality. This is already being incorporated at lots of places. Some of you may be using this in some of your educational sessions already. We think this is an early area that will continue to grow in medical education and even expand into other GME areas. Here's our contact info. Thanks for listening.
Thank you.
And hopefully we'll see you in real life at the next SAM assembly.